I think that nursing is more art than science. I stand on science. I stand on all those things that I know that happen physiologically in the body, and I encourage people, don't run from that, move towards it. It feeds your soul more than anything else.
Every second of every day, nurses on the front line face decisive moments that impact the lives of millions of people. Whether it's through hands-on care, emotional support of patients and families, or training the next generation of students to practice, nurses play a pivotal role in our healthcare system. It's an exciting time, and we are proud to be working with nurses globally who are pursuing their mission, or some say their calling, as a nurse. In a recent Wolters Kluwer survey, nurses, perhaps not surprisingly, have the most patient-centric view of healthcare. We found that they want to see real changes in healthcare so patient outcomes will improve, and nurses earlier in their careers believe addressing social determinants of health are a top priority. The survey revealed nurses believe that if they had more access to information that drives evidence-based decisions at the point of care, there would be significant improvements in outcomes. At Wolters Kluwer, we believe that every patient should benefit from the best knowledge and evidence. In recognition of the changing nursing profession and the critical and shifting role nurses have on the integrated care team, we're taking a closer look at 3 nurses, all at different stages in their careers. We see how these inspirational nurses manage the challenges of care today, balancing the art and science of nursing.
I get up every morning and come to work to do what I think most people in healthcare, and certainly most nurses do, is to help people, to make people healthier. And it's interesting because what a lot of nurses have said to me and other people in healthcare have said to me is like, how do you work with those people? You know, like, how frustrating must it be to work with people who don't want to change or can't change or don't have the resources or the literacy or the education or the, you know, like that must be endlessly frustrating. And my response is, that's why I get up every morning, because it's fascinating. It's endlessly interesting. It's endlessly rewarding. When I got out of nursing school and got my license in 1993, well, even while I was in nursing school, I was working with people in the Tenderloin district of San Francisco. Lots of single-room occupancy hotels, lots of populations that were vulnerable and kind of pushed off to the side. And the people in that hotel and those patients, they really taught me to be a nurse. Like, nursing school was helpful, right? I learned how to do procedures and skills and things like that. I didn't learn how to take care of folks like this. That's not what I was taught. They taught me how to do it. So they not only taught me how to be a nurse, but I really, you know, these folks taught me how to be a human being. But the technology has increased immensely over the years, and not just the technology of medicine, the technology of medical devices and things that we now have to take care of, but then, you know, the electronic health record and the amount of data that we have access to. I think we face as nurses huge challenges, and how do we negotiate and take advantage of the technology that we have without losing that art of nursing?
Even though patients are sicker, we are caring for them better. We are in a healthcare world where wellness is rising to the top, so prevention is important. Looking at those social determinants of health so that we can wrap that all around the patient is very important. But as care is moved out of the acute care settings to the community, we need to train our nurses to care for those patients in the settings that the patients are transitioning to. Stuart Fisk, who is the director of the Center for Inclusion Health, is a non-traditional nurse leader. He is leading at the bedside, he's leading at the clinic, he's leading at the board table, he's leading across the entire continuum, and that is the best nurse leader.
A lot of the talk that people have now, that social determinants of health, has become this huge concept that everybody's talking about. That's what we're doing. The Center for Inclusion Health developed and integrated the first social determinants of health screening tool into EPIC. And so that's becoming part of the standard of care. That's been incorporated into the nursing assessments in the inpatient settings. I still work with the same types of stigmas that we worked with 30 years ago. And that's really what we try to do in the Center for Inclusion Health, is to continue that process of breaking down the stigma, the exclusion, the saying that you should get your care over there. You know, those people, those patients, we still use that language. And they're not those patients, they're our patients. So the issue of how do you move into a population like this as a healthcare provider, into a population where there's very little trust of the healthcare system, because so many of these people have been rejected by the healthcare system because they're stigmatized and they're poorly understood. So we as healthcare providers, how we got trust was we moved into their world and we lived by their rules in many, many ways. They directed the care that we gave. You know, there's a lot of examples of people who I've worked with for decades now, who I've seen go from being really sick, addicted to substances, to being homeless, struggling with all kinds of social determinants of health. And we have worked with them over the years in all of these things. You know, we work with them in all of these domains. Yvette, for example, is a person who was a patient first. She was one of the early patients in our clinic, and we recognized that in her recovery, not only from substances, but also from health issues that she had, she wanted to give back. She had that lived experience. So we hired her, you know, as a peer to work with our patients as a living example of not only what happens when you engage in healthcare, but what happens when you engage in the right kind of healthcare. It's clinical transformation, it's teaching, and then we're looking at outcomes and programs and evaluating them. This is how we make our communities healthier. It's not about providing care to the poor and the underserved. This isn't charity work. This is how we solve the problem of the American health system and the poor health of the American population. People give back. When we give to them in the right way, they give back sometimes way more than we give.
Welcome to Nurse Talk. I'm Casey Hobbs, along with my co-host Shane Mason. Good to have you back in the booth, Shane. And we are two of the thousands of nurses on duty today. I started Nurse Talk when I was listening to a show of car talk and laughing my head off. And I thought, wow, this format would really work with nurses and give us a platform from which to speak and also hopefully make a difference in people's lives. I work for the Sequoias. It's a CCRC community, which is a caring community, a rehab facility. I am the director of nursing for skilled nursing, and how skilled nursing is used here at the Sequoias is an independent person in their apartment, let's say they take a fall and they break a hip. And they go to the hospital and now they need rehab. So they come back to our skilled nursing facility. They're there receiving physical therapy, occupational therapy, speech therapy. I got into nursing way back in the 70s. It was always that we were going to do total care, holistic care. We were going to treat the whole person. So fast forward 40 some years later, the only two places that I see we treat the whole person, hospice and a CCRC. Joe? The most important thing for me when I'm looking at hiring a new nurse is, do you have the ability to start a conversation with somebody and get their trust in 5 minutes? Because really that's the job. You know, we made a real mistake in this country when we took schools out of hospitals. So it used to be that the schools were tied into the hospitals and you worked as a CNA through nursing school. You know, you stayed there in a dormitory and you worked as you went through so that you got to see what you were really getting into. As opposed to today where you can get your RN, BSN, and master's in one fell swoop if you have another degree. And you'll come out and you will never have run a code, hung a IV, given somebody blood, been assaulted, have any of the things that happened to you in your career. A nurse who had a photographic memory, and he was brilliant. And I could name a drug and he could literally read me the PDR about that drug. Okay, fast forward several months, he's in the job. I walk into a room, he's standing frozen on a spot. The patient is not breathing. And I looked at him and I said, is he a code? And he's just frozen. And I hit the code button and I scream code blue and I drop the bed down and I start doing compressions and he's so frozen on the spot that when the code team comes in, they physically have to move him out of the way. He passed every test, I'm sure, with flying colors. His ability to function as a nurse, not as much.
Hey Casey, as always, we have a great show today. One of our most poignant interviews over the years was the story of Dr. Grace Damon. Grace, so wonderful to have you here with us.
I'm glad to be here.
So Grace, you know we're nurses, and so we're interested in knowing a little bit about what part nurses played in your career as a physician and also what part they played in your recovery.
That's a really great question. I mean, I've got to say, when I was a patient in the hospital, my rule of thumb was I would pull the covers up anytime I felt somebody come into my room who was depressed. That included nurses. So my first rule of thumb is you've got to be happy to be at work. You've got to enjoy what you do. And unfortunately, nurses are way overworked.
Yeah.
So often they don't communicate that or they don't actually feel it.
The thing that I see is I see students that are not prepared for the complexities of the healthcare system and don't really know what that's all about. A lot of times I'll have students, why did you get into nursing? I want to help people. Well, there's lots of ways that you can help people. Make sure that you understand what nursing is and that that's what you want to be doing. The big problem I see too with students is they're so young and then they go into this healthcare system that is complex and they don't get a chance to develop how they feel, because you're supposed to learn, a new EHR and, all the nursing stuff, and then you're going to watch someone die for the first time in your life.
On election day, 2016, I went into surgery for what I was absolutely convinced was not cancer, and yet everything about it said that it was cancer. And I did, like so many people I see, look away. Don't read about it, don't know about it, let's just pretend it's not cancer. I decided I would have chemo. And it was really hard to be on the other side, what I call the other side of the divide, the patient divide. Being on the other side of the divide humbled me, made me so happy to be a nurse, because that's who supported and helped me through that process. And it was really nice to then be on both sides of that picture. The experience made the experience of nursing deeper and richer, the experience of my coworkers deeper and richer, and just gave me an appreciation for life. To be a nurse is, I'm grateful. I'm grateful that that's what I was called for. And I'm grateful that I answered the call. I just encourage people, I just don't think there's a better profession out there. I say to people all the time, there's no higher calling for me than to be a nurse, than to make your occupation about bringing comfort to people.
I came across this 60 Minutes expose on nursery ships like 11 o'clock at night and watched it and was like mind blown that they can run a hospital on a ship and serve the amount of people that they serve. And so applied and ended up in Madagascar. I'm a pediatric ICU nurse as my primary role. Children's of Alabama, typical day, I may have 1 to 2 critically ill pediatric patients. On mercy ships, I may have between 2 and 6 patients. So it's interesting that I guess staffing shortage affects me more at home than abroad, but my patients at home are on hemodynamic stabilization meds and they're intubated and sedated and paralyzed, and my patients abroad, we play Uno. And I change their wounds and I give them Tylenol for pain. A lot of these patients have been ostracized from their families, from their villages. They've lived in seclusion. I started working overseas having just been a brand new nurse. 1 year out of nursing school, I was running codes. I was giving recommendations for medication dosages for children, and it just really hit me heavily. If I went back to school, there's so much more I could do.
Megan is atypical. She's always looking for something else that can make things better. A lot of nurses do that, especially in the pediatric world, but Megan just always has this purpose when she comes to work. And she is a great team player, and she takes such good care of her patients. I've been a nurse 39 years. I've seen a lot of different types of nursing. I've worked all over the United States. I've held different roles, and one of the biggest things about nursing is the changes I've seen. I think the future of nursing is allowing all these nurses, whether they're brand new nurses or even some experienced nurses, to have different opportunities to learn and to grow and to give.
I drive 2 hours to work because there is no pediatric ICU where I live. I live in an underserved area. And thinking about that and considering whether or not I would work in a developing country long term, I started thinking, where can I do the most good? I hope to open a clinic in my underserved area and serve the underserved, the marginalized. Thinking extremely long term, I finished my nurse practitioner, and then I would love to find an underserved area that could use a partner clinic and use my clinic here to partner with a clinic on the ground in a developing country and do both. It is an investment to work 12 and 16-hour shifts with critically ill, dying children. It's an investment to go overseas and work in the same field but with significantly less resources. But the return is astronomical. Overseas, we see so many success stories, thankfully, where one surgery literally just changed the course of this 3-month-old baby's entire life. And their village told their mom to bury it alive. And now they have an entire full life just by fixing a cleft lip. That just fills my heart so much. When I start to get burnout, it's time to go back to Africa.
Nurses are on the front lines of care and patient education and have a significant voice in the type of care that's being delivered. Nurses are not only caring for patients at the bedside, but also outside acute care settings, meeting patients where they are. As our healthcare system moves from a disease episodic model to one focused on wellness, care is often delivered outside of the acute care setting and in the local community. Because of this, all nurses need to keep pace with this evolution while working to elevate their individual roles on the interdisciplinary care team. Just as more experienced nurses need to pursue lifelong learning to keep pace with changes in healthcare, new nurses need the clinical, patient, and personal life experiences to be better prepared for the complexity of today's patient population. As nurses, we are the ambassadors of healthcare. We stand on the front lines of patient care, working to ensure that each and every patient is put at the center of their own care. To do this, we must elevate our roles on our care teams by staying true to our passion and to our calling. That's what being a nurse is really all about.
The kind of thing that is most transformative for me is that when I see people who, when I met them, who came to our clinics or came into our programs, their life expectancy, their risk of dying in a very short period of time is huge. And then 10 years later, I see them and they're still alive. And I look at them and I think, I knew you when the value of your life was low because you didn't have a life expectancy. And here you are. So it's that kind of stuff. It's the art of nursing.